Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you with a weekly podcast of the Common Sense MD. Today is an event I've looked forward to for a long time. We've known each other for a while, and this is Dr. Jamal Maatouk. She's an oncologist in this area. She's been around here for many, many years, and although she looks like she's about 20 years old, she's actually very experienced and has a lot of wisdom that we're going to talk about today. As you know, I talk a lot about cancer, and this is her whole life that she's been involved in treating cancer patients. There's a lot to learn. We're going to do more than one session, but I'm so honored to have you here today. It's a real honor for me that you would come on here and talk very candidly with me about cancer and lifestyle and what people can do. She's a woman of faith, and she brings that into her practice and in her life. And I admire you so much from your beginnings in Lebanon, your whole story I love. But anyway, thank you for coming on. Tell me a little bit about how you got into oncology and a little bit about yourself.
So I wanted to do medicine since I was 4, and I never changed. And you know, sometimes you have a calling. And I felt this is my calling since I was 4, which is rare to be 4 years old and state very firmly, that's what I'm going to do. I wanted to do surgery because in my mind, growing up, like if something is wrong, cut it out. You know, if you have appendix, if you have gallbladder, if you have a tumor, remove it. So I wanted to do oncologic surgery. And 3 years in my residency, I got married. And my husband, he's a doctor. He wanted to come to the U.S. So I had to resign and come with him. And God led me to internal medicine. And unexpectedly, I had 1 month in oncology. And that was it. And I'm here.
Well, hearing your story, when we sit around and eat dinner and talk about the way you came up from Lebanon, you met your husband in medical school residency. Actually, you're doing a surgery residency, and to have the courage to come over to the United States and really have to do everything over again.
Correct.
So, I mean, you're so well trained and so knowledgeable that maybe that's one thing that makes you such a great doctor. But I think a lot of it is your kindness.
Thank you. Well, I grew up believing in the goodness of God, that we are all here for a reason. And I always looked at my life like what I'm here to do. What can I serve? How can I serve? Initially, I was tougher. Like I addressed what I think was right in a tough way to people around me. And, you know, when you grow up, you get wiser. So I learned that being kind, doing the right thing, echoes more. And, you know, I think my biggest change was in the past 10, 11 years. So I see things differently now, or deeply.
And that's why I brought you on this show, and that's why I wanted to get to know you, because actually we've had some patients that have seen both of us, and we've kind of worked together on a few of them from a couple different aspects. Because when you have something like cancer, there's a lot of different perspectives on how you should treat it and how you should act as a patient. And certainly there are a lot of things that you can do, like surgery, cut it out, like you say, radiation therapy, chemotherapy. And there's also other things you can do that I do in my side of the practice that I call adjunctive treatments of cancer. When I see a new cancer patient that comes to me, the first thing I say to them, I'm not an oncologist. You should follow the directions of the oncologist. You are probably coming to me with questions on how you should be eating, your lifestyle questions, your supplements, your vitamins, maybe some other alternative treatments that I'll throw in, like you've seen my podcast on fenbendazole, ivermectin. I'm a big believer in some of these adjunctive treatments for cancer, but certainly always listen to your oncologist. Now, one thing, Dr. Maatouk, I want to ask you is, to me, oncology is such a hard specialty, not only with keeping up with everything, all these new drugs, the new immunotherapies, besides the chemotherapies, also the emotional toll it takes on you, because these are patients that a lot of times are in the process of dying, and which we're all born to die. And the one thing I love about you is your approach to that, because there's a good way to die, and you certainly are saving people, but you're also, for some individuals, you're also teaching them the proper way to end life. So how do you face that, and how do you do that?
I didn't know how to do it 15 years ago. So I was frustrated, mad at God 15 years ago when I was seeing some young people suffering and struggling. So it was challenging, and that's when I started digging more and reading more and praying more and thinking more. And one book led me to the other, and I understood that death is part of life, and it's our right to die, because our soul is here passing through, learning, experiencing, and going back home. It's like a play. So when we look at life like this, then death is not scary. It's part of life. It's our right, actually, to go back home. So, and there's a lot of people who fear death, and I want to help them die in peace and understand that this is not scary. So this is why, part of why I do what I do is mainly to help people die in peace, because I can't heal everyone. And not everyone needs healing. Sometimes they don't know it as a human, but sometimes their soul is ready to fly home, and they're resisting. So I just walk through them, help them understand what do they want, especially when they're at a point where the suffering is more than a human body can handle. So I try. I can't force anything on anyone, so I try to help them understand or guide them. Some people understand with direct words. Some people I have to handle it kindly or indirectly, so I don't shock them, because you have to meet people where they are. And I want to help everyone without shocking them. So it's patient by patient.
It's a difficult thing to really deal with, and as you say, as a physician, you get better at it with more experience. And certainly, you just reminded me of the podcast I did with Dr. Ben Edwards a few weeks ago. I think you watched it. And he's a family doctor in Texas who does a lot of integrative medicine like I do, and he has a faith-based practice, and he deals with the measles, and that's why I got him on, because he's dealing with all the kids with measles in Texas. There was a lot of misinformation about those kids. But in any event, at the end of that podcast, I asked him, so Ben, should we fear measles? And his answer to me was, Tom, you shouldn't fear anything.
True.
And you're telling me the same thing with cancer. And I really love that about you. And you're exactly right. We should not fear it. Because, like we say, we're all born to die. And hopefully there's ways you can prevent cancer. And that's what we're going to talk about a little bit too. So let's talk about, in general, cancer. What kind of trends have you seen with cancer in this country in the decades that you've been practicing? What would you say sticks out in your mind about cancer in general?
It's increasing in diagnosis, and could be lifestyle, unhealthy diet, unhealthy habits, unhealthy fear, anxiety, stress, and what happened in the past 5 years also. So all together increase the rate of diagnosis. And sometimes we're having 2 cancer in 1 patient. So it's increasing.
I've heard it called turbo cancers. Do you think that's a term that's certainly not a medical term at this point, but are you seeing what we would call more cancers in the last 5 years than we've ever seen before? And maybe like seeing 2 at the same time, and they seem to be more aggressive?
I've seen that term on some of the data that I've been reading, yes.
So, without getting into specifics, why over the last 5 years, as you know, we've had some viruses around, we've had some vaccines around that haven't proven to be very effective, and in a lot of cases, in my experience, I've seen to be very dangerous. And I try to urge people not to get that booster type shot. Please don't do it. And I'm not ashamed to say that. I know I got kind of tarnished a little bit by that in some people's mind, when I tell them not to do it. But in retrospect, I'm pretty sure I was right about that. As physicians, we're like coaches. We try to give great advice. And what you're talking about is called cognitive dissonance, and doctors are the worst people for that. If you want to see some examples, read Dr. Marty Makery's book from Johns Hopkins called Blind Spots.
I read it.
It's a fantastic book, and if you want to know about the inner workings of a doctor's mind and why they stick to what they learned 30 years ago and won't accept anything new in the face of overwhelming evidence that something is not working.
But we have to also remember, we doctors, we're trained to follow rules.
We were.
So, and that's not medicine. Medicine is an art, it's intuitive. That's what we signed up for. Every person is different. I cannot treat 2 persons the same way. We don't look the same. Nobody looks like any other person. So if outside we don't look alike, definitely inside we don't look alike. So I cannot treat 2 people the same way. One size don't fit all. So we cannot stay in the line if we want to be good doctors.
Agree 100%. You have to think outside the box. You have to use that experience you have, and sometimes a gut feeling. I've been practicing 40 years, and a lot of times now I get a feeling that this is the right thing to do for that patient, even though I couldn't go to a book and it would say, do this. And I think too many doctors are so overwhelmed with the amount of patients they have to see, and even their particular board society may discourage them from thinking outside the box, or tell them you have to start everybody on this medicine if they have a certain number. People aren't numbers. People are people, and that's what you should treat, and you should actually listen to your patients.
Right. Well, it's not only listening with the voice. There's something different when you sit with another person and you give them all your attention, and their body, their soul tell us what they need. It's like when you connect with someone deeply at the soul level, you will know what they need. And that's what I try to do. Some people come because they need healing. They need to live longer. They need to accomplish more. But some people come so they understand how to die in peace. So it's weird, but this is a gift that we all have, is to listen to each other deeply. We're all connected. There's no 2 of us. We are all one. So when you sit with a patient, to me, I connect with them. Maybe they don't know it. A lot of them don't know it. But when I'm listening to them, I'm praying. What do they need? God help me. And the minute I ask the question, I get the answer. Whether I share it with them or not, I know how to help them. And that's what I want to do. Some people come for chemotherapy, I have plenty. Some people come for support, and I have plenty. So it's different.
You're a unique doctor, because most doctors do not want to get that emotionally involved with their patients. In fact, I think we're almost really taught not to.
Correct.
in medical school.
And that's not why most of us doctor initially chose to be doctors.
Right. That's right.
But
We wanted to help people, and then we were
correct.
almost brainwashed into treating
Correct.
people a certain way by cookbook medicine.
Correct. And with my respect to all medical schools, I think there should be some changes. I mean, we cannot separate soul, mind, and body. There is no way to help someone by categorizing the person as only a body. We're not a body. We are souls, spirit, mind, and body. I cannot treat one side of the person, and I don't want to do it.
I'm so glad there are doctors like you out there, and there's plenty of them. It's not the rule, but
There's a lot, yeah.
There's more out there than you might think. And I agree. Most doctors get into medicine to help. They want to help people, and they usually are the kind of people that like to study and like knowledge.
Mm-hmm.
And
But you know, they tell us to be a good doctor, you have to follow the rules. You have to study those books and move by it. That's not what Hippocrates told us. That's not what we signed up for.
exactly right. I call myself kind of the anti-medical establishment doctor because I definitely think it's going the wrong way. It's amazing in our country that we can do all these amazing kind of surgeries, the new immunotherapies. Incredible. You can operate intrauterine on a fetus, on a heart problem. And yet, here we are as a country, we rank 33 in industrialized nations on our health scale. So we're an obese, out of shape, stressed out population. And I think stress causes anything out there, including cancer.
Mm-hmm. Well, as you asked me earlier when first we started, what causes cancer? Well, environmental issues can cause cancer because 4 or 5% of genetic mutation are only culprit of genetic cancer. What about the other 96%? It's all environmental. It's where we put our body, what we put in our body, and what we think and what we feel, because we're connected. I cannot separate, as I just said, I cannot tell you I don't know, when something makes us turn red or emotional, it's an idea, it's a thought that triggered all the chemical from the adrenal gland, going up to the brain, back to the skin, make us blush. What does this tell us? Our thought is affecting our body. This is the simplest way. If my thought can turn my skin red, then it can cause diseases and mutations in my cells. We have 50 trillion cells multiplying nonstop. Maybe by the time we started talking till now, we all had, 50,000 mutations that could lead to cancer. But we don't have cancer every second because our T cell, our macrophages, our natural killer cells see it, eat it, kill it, get rid of it before we know. So we have to work on our immune system. If our immune system is strong, it protects us. And how do we work on our immune system? Healthy mind, healthy diet, and healthy habit all together. In this way, our immune system is relaxed, can heal, and can function well. If we are in fight and flight from stress and fear from cancer because a family member had cancer, or fear from, dying, all this is a fear. It's the lowest emotion on the vibration scale. So our immunity is down, and then cancer can happen.
That's exactly right. The immune system and inflammation. If your body's inflamed, you're going to get all diseases, in my opinion, are caused by inflammation. And God gave us these wonderful things, like you just said, the T cells and macrophages, the natural killer cells. We probably all have these cancer cells, which are just rapidly dividing cells. We all have them in our body. Our body is meant to fight them off and to filter them out. And given the right conditions that you put your body in, you don't have to worry about it.
100%. We're perfectly made to heal and regenerate every second. Every 7 years, we have 100% full badge of cells of body. That's why we don't look like what we looked when we were 6 or 7. We renew and rejuvenate every year. Nothing say that when we renew, we have to become sick.
Exactly. Let me ask you, that brings up a great thought. So all these genetic cancer tests that people are running out to get, full body MRIs for early detection of cancer, shouldn't we just concentrate on, eating right, sleeping, having good relationships, being able to do a few push-ups, and, instead of worrying about your genetics? Tell me about that.
Yes, I agree, because to me, epigenetic is more powerful than the gene. The genes are like, as Bruce Lipton say, Christmas tree light. If you don't plug it, it doesn't light up.
I love that.
So
Epigenetics. Explain to the people that may not know what epigenetics is.
So epigenetic is a science that started in 1930 something, and I'm not good with dates. So it tell us this is the science above the gene. Think about it as 2 tomato plant. We put one in the light, we water it, it makes a tomato plant and give us tomato. The other one, we put it in the dark, we don't water it, it never grows. Same thing with our gene. We have, let's say, proto-oncogene that could lead to cancer. If you don't water it, if you don't give it the environment to flourish and make cancer, it will stay dormant. It will never cause cancer. It's like the BRCA gene mutation that causes breast cancer. Why only 60-something% of ladies that has it has cancer? What about the other 40? Why they don't have cancer and they have the gene? It's the same thing. So it comes back to the same idea where we put the gene, the mind. They adopted in one of the trial for epigenetic a child from another country. They put it in a family in the US that has a very rare type of cancer. The child is from another country. He grew up and had developed the same cancer that the family has. He doesn't have the gene. What does this tell us? Our mind is so powerful. So it goes also to connect with the placebo effect and the nocebo effect. It goes back that we are powerful as a human being. We own our healing and we own our illness. So both goes along.
I love this. When we were eating dinner one night with your husband, who's also a great physician, he was telling me the story of one of his colleagues from Lebanon who had come over and lived the American lifestyle of our diet and lack of exercise, and became so obese that he had to move back there in order to get a wife to marry, because over here he was just too obese and, I don't know, I don't want to say
healthy.
Unattractive, but in any event, so he goes back to Lebanon and gets healthy again, moves back over here because the medical environment may be a little better. Lebanon's an area that is tough as far as wars and all that, in trouble. Then he moves back here for the medical part, and the same thing happens to him. Mm-hmm. It's like looking at the twin studies of identical twins that grow up in different environments, mm-hmm. and how they can pick up things like cancer, heart disease, that the other one doesn't get because they're in a better environment.
It's an environment. And it's inner environment, body and soul and mind all together. There is no separation. There's
no separation mm-hmm. of your soul and mind, like Dr. Edwards and I were talking about a couple of podcasts ago. A lot of it comes down to, your faith, but also your attitude about things. Mm-hmm. If you have a positive attitude, I think that's half the battle right there. We have the means to help people stay healthy. Accountability is something else. And that's something that we're really doing a project on, how to keep people accountable, because they come to see us as doctors and we can coach them and all this, but we'll see them back in 3 or 4 months. How do we know that they are doing what we told them to do, as far as what they should eat, the supplements they should take, even their medications? How do we know they're doing it? And that's something that we're really working very hard on to be able to track. And stay tuned, because I talked to a couple of guys from Miami. One was a neurosurgeon yesterday about this program that it kind of has a lot to do with the Wharton School of Business. One of our colleagues is attending there right now. And so stay tuned about this. So, all right, we're going to wrap up this session of talking about cancer in general with Dr. Maatouk. And we'll get back. We're going to talk about some more specifics on our next podcast. So I really appreciate you being
Thank
here
you.
today. And it's just incredible to talk to you. Please share this video because you're getting wisdom out of this from somebody who knows. So thank you so much.
Thank you.
We will see you guys next week. We're going to talk more about this. See you next week.
Thank you.